we got new advice inside here this week. This advice, I don't want to relay the whole story again, but it means that I have a clock, stopwatch here, measuring the length of time. I spent 2 hours inside here. I broke this rule last week because I was in with you and I was in with the Taoiseach. So I think to all of us inside here, this was new. We didn't know. We thought 2 hours and break, you could come back. So this was new. So when did you first become aware? When did you, as Minister for Health, first become aware of this rule in relation to workplace settings? We can't have one rule for here and one rule for somewhere else. Workplace settings, you had to spend 2 hours in any 24 hours, and if you went beyond that, you're creating a close contact, thereby obviously creating risk. When did you first become aware of that?
This week, I believe, Deputy Kelly. But my understanding on this, just to be clear, because I've heard this represented through the day, and I've heard people asking for the Taoiseach to clarify it and the likes. I'm open to correction here, like from the authorities and the Oireachtas. But my understanding is that the Oireachtas brought in a public health expert. I heard Deputy O'Reilly describe the person as an independent public health expert to assess this workplace and to provide guidance to not just TDs and senators, not just TDs, senators, ministers, but to everybody who works in this place. We have a duty of care to as well, our own staff and everybody else. And that was the viewpoint of that. And I'm only going along with that, not as a minister, but as a TD in my workplace. So I believe that's the Oireachtas' public health advice from an independent expert brought in by them.
So, but this advice is endorsed by the CMO. It's endorsed by NEFIT. So on page 4 of the Guidelines for Public Health Management of Contracts of Cases of COVID-19, it seems to be updated to reflect this. So if you only become, or we need clarity here, there's confusion. So if you only became aware of it this week, but this was, unless nobody else ever asked the question, but this is what NEFIT's advice is. Now, for the public out there, we can't have two rules. I referenced George Orwell earlier. I'm not going to reference it again. But we can't have two rules. So if you only found out about it this week, but it is NEFIT's advice, although it's coming through a circuitous route via the Oireachtas getting advice from another individual, how is it that this week only this was socialised to everybody else? And was there not risk being created across all community by the fact that this hadn't been socialised before this? How are people meant to operate in shops, in factories, where you can only spend 2 hours within 24 hours in a space, otherwise you're creating close contacts, and if anybody obviously gets infected, then everybody will have to isolate for 14 days. So you take my local shop. They hadn't a clue about this. So effectively, if any one of them had to get this, they would have to close the shop. So it's not, viability is a key issue here. So Minister, why wasn't this socialised? If NEFIT were aware of this, why wasn't it socialised before? This has huge ramifications, respectfully, huge ramifications. And also, may I ask the following question? Who initiated the request for advice as regards concern on the sitting? And I accept public health advice, that's not the issue. Who initiated the conversation between the Oireachtas and the Department of Health regarding the first COVID sitting and concerns?
I truthfully don't know. I truthfully don't know that. I'm sure we can find that out, Deputy Kelly.
Okay, you might.
I will indeed. So just to be very clear, sorry, I'm aware of the 15 minutes within two meetings we become a close contact. I'm aware of the 2 hours we become a close contact. It's the question as to how long you must leave an area and before you come back
it's
that I
2
first
hours
became aware
within 24 hours?
This year, that it's not, this week, that it's not, that you need to have a 24-hour period. Look, I'm a member of this House and want this House to be able to do its business. I'm one of the few people who's here answering questions every single week, along with the Taoiseach and a couple of others. And I'm sure there are ways. we can get this right. I'm a receiver of the advice.
It's broader than this House, Minister.
Rather than a maker of it. But my understanding, and the Ceann Comhairle and the authorities, I'm sure, can clarify this, is that the Oireachtas made a decision to seek public health advice in terms of how it conducts its business, and the Oireachtas is sharing that public health advice with members.
Okay, can you answer my question?
And you're not any lesser a member when you become minister either, in terms of your own health and my own personal health.
I respect that
as well. In relation to other workplaces, again, and I heard the Deputy Chief Medical Officer talk about this yesterday. I mean, it is about carrying out a risk-based assessment in any workplace, and there are a variety of factors that can pertain to the safety of a location, how long to spend in a room and the likes as well. But I'm sure there can be more clarification. I hope there can be a way found forward in this regard. I thought the COVID committee was coming up with innovative ways to make sure it can do its business. It's crucial it does its business. Parliaments all around the world are doing their business.
Minister, with respect, to be fair, my question isn't orientated around what happens in here. I'm worried about the people in my local shop. How are they meant to do a risk assessment? It would basically mean that they would have to have a whole load of more employees, and it would make the business unviable. So I again ask you a question, because you didn't answer it. How come this information was not socialised, put out there, public health information across the country previously? How did it just appear all of a sudden this week? You're the Minister for Health. Tell everybody in this country who owns a shop, tell pharmacists, how are they meant to operate in these conditions? They have to go off and get an assessment. Many people working in these areas, firstly, how they do that is questionable, who's professional enough to do it. But secondly, it wouldn't be viable. Meat factories, shops, anywhere in retail, all of the people who are producing our food, how are they meant to operate under these guidelines? And then I don't buy this thing of, every area is different. Rooms have a certain square footage. There are people inside there. We're expecting people who are working at checkouts to spend 6 hours working together, or 8 hours, and they're going to be in the same environment. There is a risk here that either was known and wasn't spoken about, or else it's just new advice. You found out about last week. The whole country is depending on what you're going to say here now, because we need to know why this wasn't socialised, or else it's new advice. Because if it was there and people weren't told, then risk has been created and people weren't told about it.
I doubt the whole country is waiting to hear what I'm going to say in relation to this, but just to be very clear, there was workplace protection and improvement guidance issued for all workplaces that are open by the NSAI on the 27th of March. So they're the people, I'm sure, the people right around the country and businesses are taking their advice from. There is guidance issued for lots of different sectors. There's guidance issued by the National Outbreak Control Team in relation to meat factories. There's been guidance issued specifically by HIQA in relation to nursing homes. So, Deputy, it has been the case, and is, I think, the world over, that different settings have different guidance. There's been a debate since the very start of this pandemic as to whether this Oireachtas should look at minimising on fulfilling our own duties of working from home using virtual technology. There's been good ways of using committee rooms and video links. My understanding is the Oireachtas asked for a piece of public health advice, and I'm following it. And no, that's my understanding how it surfaced.
It's not the question I asked.
That's my understanding. But you're asking, it's the answer to the question, though. The answer to the question is, why did this become socialised this week? Because the Oireachtas asked somebody to come in and assess our workplace, and not just for you and I, Deputy, but for our staff, for the staff who work here, for the staff. Well, we'll talk about that as well. But I'm following the public health advice here in this workplace. So are you, for your staff. Everybody has to follow the public health advice in their workplace. There's a HSA in place that can go in and has carried out 190 inspections of workplaces between this Monday and Tuesday alone this week. So every workplace has to operate in a safe way, and we need to lead by example. But I do also think we need to find a way forward in relation to this. I mean, the Oireachtas needs to be able to do its business. It can't be beyond us.
You keep answering the question you weren't asked. So, I mean, I've asked a number of times. You're refusing to answer the question, Minister. Hold on, let me finish. Now, I've only a certain amount of time. You're refusing to answer the question. All the other sectors across Ireland, what are they meant to do here now? The meat factories, pharmacists, those who are really there to serve us and are doing a fantastic job across the country, providing food, providing medicine, etc. But if we apply the rules, what we're applying here to them, they can't operate, or they're not viable in many cases. So I ask one last time, and give you one last, why did this all of a sudden arrive this week? If NEFID knew this to be the situation for an area like this, and an organisation like the Dáil, how comes a similar advice wasn't given to all the other sectors? And surely we're going to have to give advice to all sectors across the country. But based on viability, based on what is happening inside here, why hasn't this happened already?
An effort for everything, Deputy Kelly. The Oireachtas asked someone to come in here and give advice. That's nothing to do with them. So this obsession with blaming, you're nearly blaming NEFIT for COVID next. I mean, NEFIT didn't give the advice. Okay, I withdraw that. NEFIT didn't do this. There is guidance in place. The pharmacist says people are putting different protections in place. Some people are putting up perspex. Some people are wearing face masks. Some people aren't allowed open. Some people are only opening for takeaway. Some people are coming to sealed rooms and they're working in different ways. I'm very grateful to doctors for giving us advice on how to protect our health. I'm very grateful for doctors around the country putting guidance in place for different sectors as to how people should protect their place. And remember, as of today, most workplaces can't open, such as the risk of this virus.
On behalf of the